one of the things that I saw was that hospital care became even somewhat dangerous. People were dying in the hospital. What I would say, simple and effective treatments were being discouraged or abandoned in favor of these new vaccines that were rolling out, and in favor of pharmaceutical treatments that were new or untried. And we were told not to use things that seemed to be working, such as ivermectin and quinine preparations and some other things, which I was using in my practice and seeing success with. So it was a confusing time. Also, doctors were being impeded from communicating with each other. Historically, when some new problem arises, a new illness perhaps, or an epidemic or something, doctors begin to communicate about what they're doing, what's working, what isn't working, and this communication, for the first time in my experience, was literally being impeded. I was censored. I was taken off social media when I was posting what I had been seeing, what seemed to be working, and trying to learn from other doctors what was working. And so I'd never seen anything like that in my life.
Because you're right, none of us had ever seen anything like that, ever. There's several hurdles that are going to be necessary for the Alaska Medical Board to overcome regarding my professional behavior. And one of them is that I wrote a prescription that misrepresented the reason for its purpose. And I want to ask you something in this context. Because little background there, a lot of people were going to feed stores, they were getting injections and paste of ivermectin.
Your Honor, I'm going to object to the fact that this is not a question.
Oh, I apologize. People were searching out.
That's still not.
Oh, so
what is the question for Dr. Zeff? Go through
is
the
there
part of your brain where you give an explanation
is there
in front of it.
Is there ever a time where it's ethical to have a different representation on the prescription, not in the chart notes, but on the prescription, to ensure they receive human grade safe medication that we can
Your Honor, this is just testimony. This is not a question.
I'm asking him if
I'm going to sustain the objection and ask you to ask a direct question on whether it is ethical to misstate the reason a medication is being prescribed when requesting having that medicine filled by a pharmacy.
Okay. So Dr. Zeff, my understanding of the lack of ethics in doing that, is there ever a time, in your opinion, is there ever a time frame where something could override that?
Yes.
Can you elaborate for us?
In the first place, doctors do not write the reason for a prescription on the prescription. The doctor's job is to determine what's the appropriate medicine to write for that, and the pharmacist's job is to fulfill it. For the first time in my professional career, I was being asked by some pharmacies whether I was prescribing this for COVID or whether I was prescribing it for something else, like parasites. That's politics, and it has no place in medicine. My job is to get the best medicine to my patients, and I will do whatever I need to do that. And if that means I have to say someone may have parasites, which they do anyway, I will give them, I will say that if I have to say that, because My concern is healing my patient, not the political games that we were subjected to during that time, which I'd never seen prior to that, and that's fading away now, fortunately.
Thank you. I think the issue at hand still goes back to
Try to focus on the question,
pardon me,
Mr. Miller.
When a board is evaluating an applicant's fitness, these factors come into play. What would your advice or recommendation be for the members of the Alaska board when they're looking at these very, very unique types of situations?
I would say that we have to consider the fact that this was a very unusual time when politics were interfering with the good practice of medicine, and physicians were being forced to do things that they didn't want to do. Many physicians were forced to leave medicine because they refused to get a vaccine, which wasn't really a vaccine, and which is later proven to be dangerous, which many of us knew ahead of time. The research was out. And so we have to do what we have to do. My primary concern is what's in the best interest of my patient. I always do my best to practice legally, to practice according to the statutory regulations and the administrative rules, and I've been doing that for the last 45 years. But there's times when things don't quite fit, and you have to do what you need to. You have to make things fit as best you can. And I think this was one of those circumstances, and I hope we never see that again.
Agreed. Thank you. Another hurdle, I would imagine,